So I came into upper cervical when I had gotten rear-ended at a stoplight, and I had a minor concussion, but primarily my issues were that I was just like completely out of it. I had all of this brain fog. I was in constant chronic pain, like just sort of this like systemic full body, like use everything. I couldn't sleep. I was just stressed all the time. And I sort of assumed that that was how I was going to be for the rest of my life. So I was like 23, sort of assuming that I was going to just be under this like constant state of like dread to have to get out of bed in the morning. And when I first came to upper cervical, I was a little bit suspicious because I don't know, there's obviously no surgery, no medication. I think it seemed a little bit, too good to be true. And my like knowledge about chiropractors before it was exclusively them cracking your head or doing neck stuff and like the popping, the cracking. So I was a little bit apprehensive. But everything about the way that Dr. Lawlor works, from getting imaging to making sure there's a very precise awareness about like what your issues are specifically, it was just a completely different type of care than anything I'd ever experienced, either through medical doctors or through other chiropractors. And so, I think it took about 10 months. I started at first coming in like 2 to 3 times a week. Sometimes he wouldn't need to adjust me and it was just to check in. And then eventually like a couple times a month, and now once every few months. But the results have been completely transformative. I don't have any pain. I don't have any of the brain fog. Even when like I hit my head and things fall out, I'll get like a little bit of like, feeling a little bit off or feeling like there's like a kink in my back, but it's nothing compared to what it was before. I can't recommend it enough. I think if you are someone who experiences like spinal issues or anything relating to upper cervical pain, like this is completely transformative. And I think a lot of people probably don't even realize like some of the symptoms that they have that might be related to having their C2 out or whatever it is, just in terms of brain fog, concussive symptoms, systemic pain, issues with your hips, issues with your lower back, like all sorts of things that are interconnected. So yes, can't recommend it enough.
Thank you. Oh, if you were a baked potato, no, if you were a potato, if you're a potato, how would you like to be cooked?
Oh my gosh, mashed.
Mashed. Okay.
Yes.
Thank you.